Maddie and I are just going to do a little example of how we try to clean dogs' ears. Pretty much the ear in the dog involves the pinna, which is what we call the ear flap, and then the ear canal, which has a vertical component which runs down in Ellie here for about sort of 2.5-3 centimetres, and then a horizontal component that runs in towards the eardrum. So if we look at this diagram, that is the ear flap, and then this is the red part that we can see in Ellie's ear, which is quite inflamed, and then we have a vertical ear canal and a horizontal ear canal. So pretty much when we're washing these parts of the ear canal, we just want to deposit the wash down into the vertical ear canal. We don't want to be sticking things way down towards the eardrum. So we'll just have a go at doing that right now with her. So we can actually put the ear wash into the vertical ear canal and gently then actually massage the ear canal, just nice and gently. Oh, and she's loving that. And then basically we just stand back and close our eyes because we know that she's going to do a big flap like that. And then all we do is gently clean the outside of the ear, which will then clean away any of the debris that's come up from the horizontal and vertical ear canal. Okay, now we're going to talk about actually applying ear treatments. So these are an antifungal and antibacterial ear treatment for dogs and also for cats. So Ellie's had what we call a cytology of this ear canal, and we found that she has a yeast called malassezia, which is really common in dogs that especially have some degree of allergic skin disease. You can see how the ear's quite red and angry. Dogs that are very well behaved, we can actually put the whole nozzle down there, and it's only going down the vertical ear canal, but there's generally no need. In this situation, she has actually got malassezia in this area around the external meatus, but we also want to deposit some of the drops, and people, rather than we tend to just apply a liberal amount of the drops down the ear canal and then massage them in, and obviously gravity will feed that down the vertical ear canal, which I'll just, because she's so good, we'll just do it with it. So that's the vertical ear canal, the length of that, and then we've still got the horizontal ear canal going in. But we don't need to necessarily jam this down the vertical ear canal, which will be quite painful. And then at the end of that, make sure that you give them a treat, because they've been really good. So we generally don't do the washing and the drops at the same time unless you're directed by your vet. Quite often the pH of these interferes with the activity of the drops, so we'll often do them at different times of day, or sometimes just applying, we will clean the ears under anaesthetic here and then just apply drops afterwards. That's you, Michelle.